A very good evening all. I'm Aditi Lama and this is the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 118 million cases of COVID-19 with more than 2.5 million deaths. Here in the United States, we're at more than 527,000 COVID-19 deaths with more than 29 million cases. So please remember to maintain social distance, wash hands, and please wear a mask to stop the spread of coronavirus. Today, the U.S. Centers for Disease Control and Prevention said that it has administered more than 95 million doses of COVID-19 vaccines from Moderna, Pfizer, and Johnson & Johnson and have distributed more than 127 million doses across the nation. On vaccines, the White House has said that the Biden administration is arranging to purchase additional 100 million doses of COVID-19 vaccine from Johnson & Johnson. This hopes to ramp up the vaccination program, which currently still sees demand exceeding supply. In politics, the House has passed a massive $1.9 trillion COVID-19 relief package of President Biden. President Biden is expected to sign the bill into law this coming Friday. More on this massive relief package and COVID-19 updates we bring to you tonight. Political commentators, doctors, and much more. Here are the headlines. Dr. Purvi addresses COVID-19 vaccines and variants, New York City. U.S. Congress passes Biden's COVID-19 relief bill featuring veteran journalist Rohit, Vyas, New Jersey. Indian Consulate and Gap's Technology hosts Virtual International Women's Day 2021, New York City. It's time for a short break with us on Vision of Asia South Asian News segment. We'll be right back. And welcome back. I am Aditi Lama and this is Vision of Asia, Wednesday night episode of South Asian News. Let's now take a look at coronavirus measures and updates. The CDC today said that they continue to collect data on the safety of COVID-19 vaccines in pregnant women through its registry called VSafe. Nation's leading health expert Dr. Anthony Fauci said that several thousands of pregnant individuals have actually gotten vaccinated and that the CDC is currently monitoring the outcomes among vaccinated pregnant individuals. So far, the results seem positive. Meanwhile, starting today, Texans are no longer under a statewide mandate to wear masks in public. The governor of the state has also eased other restrictions such as fully opening up businesses. Federal leaders as well as healthcare professionals in the country are pushing back against lifting restrictions and worry that this move will impact the current downward trajectory of COVID-19 cases and deaths, especially with variants spreading all across. On this and much more, we spoke with expert Dr. Purvi, urging all to stay vigilant. Here is Dr. Parikh. Today, the CDC said it's monitoring pregnant women that are getting vaccinated across the nation. There are thousands of women who have been vaccinated currently, and so far they're saying there are no negative signs or side effects on the pregnant woman from these vaccines. So my first question to you has to be, how are you looking at this, and do you recommend pregnant women getting the vaccination?
Right. Absolutely. What we've had a lot of data now. I think over 30,000 pregnant women have been vaccinated to date. And we're finding that there's no increased risk of any problems, compared with women who didn't have the vaccine when they were pregnant. So I would definitely encourage it because COVID-19, if a pregnant woman catches it, is much worse. It's actually considered high risk. And all of us have heard stories, unfortunately, where, pregnant mothers have been in the intensive care unit and either the baby didn't make it or the mom didn't make it. So if you are pregnant, I definitely would encourage that you get the vaccine, because if you catch COVID-19, you're at much higher risk. And then there's 2 lives in danger instead of 1.
Right. When you're looking at the pregnant women, Dr. Parikh, do you recommend women that are very close to delivering of getting COVID-19 vaccine? Is it more for people that are in earlier stages of their pregnancy?
Yeah, I mean, we actually have data of women getting it throughout their pregnancy and doing very well, especially those who are in high risk groups like healthcare workers, or if you have other medical problems that put you at higher risk for COVID-19, then it's even more reason that you should get it. Also, there were women who were in the clinical trials that became pregnant, even after their first dose or their second dose, and they're all doing well now. So it looks like it is very safe, even in all trimesters of pregnancy.
Right. And just talking about women, a recent research, Dr. Parikh, has said that perhaps women are getting more side effects of the COVID-19 vaccine in comparison to men. I'd like to know why that is happening. There are some statistics about it too.
Right. And so in terms of side effects, all of the side effects from these vaccines are very short-lived, meaning none of them are serious, none of them are severe, none are permanent, and many are expected from many vaccines. So for example, you might get fever, chills, achiness. Again, you're not getting sick, but basically it's your immune system reacting to the vaccine. And in general, women's immune systems are more reactogenic. So for example, like women are more prone to allergies than to men. Women are more prone to autoimmune diseases than men. But that doesn't mean that the vaccine is unsafe for women. It just means that their immune systems may react a little more strongly. But again, these are all expected side effects, and none are permanent or dangerous.
Right. And when you're looking at vaccine, I have to ask you, how are you looking at the Johnson & Johnson distribution and the administration of the vaccine? People are still concerned about the fact that the efficacy is low in comparison to Pfizer and Moderna. What do you have to say to that?
Right. I wouldn't really compare the efficacy at all, actually, because Moderna and Pfizer, that efficacy was studied when there were no variants around. So if we were to study all three of them at the same time in the same trial, we might find that the efficacy may actually be very similar, So you can't really say that one is more effective than the other. The most important thing is that Johnson & Johnson prevents death completely by 100%, and also prevents hospitalization by 100%, which is huge, because this way, if you get sick, it will save your life. It will keep you out of the hospital, and those are the things that are most important. So I would still get it, because even in areas of the world like South Africa, it still prevented death and it still prevented hospitalization. So I think it's a very efficacious shot. It's only one shot too, which is a big benefit. You get immune much faster than with the other two vaccines. So we're encouraging people to take whichever is offered to them first.
And Johnson & Johnson has said that they're also working and studying on a booster shot that could be given after the initial vaccine dose. How are you looking at that? How important do you think that is going to be?
Yeah, so not just Johnson & Johnson, but both Moderna and Pfizer are also looking at booster shots, because right now it looks like that all the vaccines are doing pretty well with the variants, but we don't know if that may change. So we don't know if that extra booster is needed. Two, we also don't know how long the immunity lasts. We're projecting a year, but we're hoping even more so. So we'll see. That's why we do the studies, to see if the booster is needed and what that will look like.
Right. Let's now talk about the variants, Dr. Parikh. I have a couple of questions regarding it. The New York variant has been considered highly contagious, and the UK variant is considered more deadly. Just in New York City right now, 51% of COVID-19 cases are due to the variants. Can you explain to me why this variant is spreading so quickly and so fast? And how worried are you when you're looking at the downward trajectory of cases, but these variants are coming in now?
Right. So these variants are not unexpected. So these viruses mutate anyway every 2 weeks. The problem is when there's too many mutations where it makes these variants, or makes a virus more contagious or more deadly, or God forbid, makes it so that the vaccines are less efficacious, and variants come out more quickly when the virus is allowed to replicate. So it can't really mutate if the virus has nowhere to go. And this is why it's still so important to keep masking and distancing and washing your hands and following those guidelines, because that's what's going to prevent these variants from occurring. Also, as more people get vaccinated, that will also prevent new variants from emerging. because then it's less likely that people are passing the virus on from person to person. So, all of these measures are important. I think, as these cases go down, the more important thing is looking at those vaccine numbers going up, because if the vaccinations continue to be more than confirmed cases, then we have a good chance against these variants, because then it'll be less likely that new variants will emerge, because hopefully the spread and the transmission will be less.
This week we are celebrating International Women's Day, an occasion that is a focal point in women's rights movement, bringing attention to issues such as gender equality, reproductive rights, and violence against women. It has been adopted by organizations across the globe, including the United Nations, and gets marked by calls for a radical change and respect for women. This year, International Women's Day saw a theme of choose to challenge, stating we're all responsible for our own thoughts and actions, and we can all choose to challenge gender disparity and inequality. We can choose to seek out and celebrate women's achievements to make an inclusive world. On that theme of choose to challenge, the Indian Consulate in New York, in collaboration with GAF's technology, hosted a virtual celebration for International Women's Day. The virtual event saw several speakers and key members, including popular Indian actress Varalakshmi Sarathkumar. Here is the story.
You may write me down in history with your bitter, twisted lies. You may trod me in the very dirt, but still like dust I'll arise. Does my sassiness upset you? Why are you beset with gloom? Just because I walk as if I have oil wells pumping in my living room. Just like moons and like suns, with the certainty of tides, just like hope springing high, still I rise. Did you want to see me broken, bowed head and lowered eyes, shoulders falling down like teardrops, weakened by my soulful cries? Does my sassiness upset you? Don't take it so hard just because I laugh, as if I have gold mines digging in my own backyard. You can shoot me with your words, you can cut me with your lies, you can kill me with your hatefulness, but just like life, I rise.
Image is based in my roots in Indian classical, hip-hop, and contemporary vocabularies. But it's ultimately my way of using multicultural movement, music, and film to tell globally relevant stories. As a female artist in an industry with enormous gender, racial, systematic inequalities, I choose to challenge. Women have the undeniable power to confront systems that don't serve everyone. And we are just beginning to acknowledge the women all over the world grabbing the reins and taking control over the
Today's theme, Choose to Challenge, is really close to my heart. I have lived the challenge of a woman climbing the corporate ladder and subsequently the challenge of women's entrepreneurship. I subsequently have dedicated time to mentoring women and later in my career sponsoring women so that they could grow in their careers. I believe that everyone has the potential to go way beyond how they perceive their potential. But until we live in a gender equal world, men and women alike must choose to challenge to help women reach their full potential. So I'm going to challenge you during this celebration to ponder the question, how are you helping to forge a gender neutral world?
So I was reading about Clara Zetkin, who was born in 1857. In 1911, as an offshoot of their socialist movement in Germany, she promoted the Women's Day, which is now celebrated on March 8th. We are of the belief that in life, you need to have intention, you need to have attention, and then attitude follows. And it is our humble effort to genuinely be one of the leading companies empowering women and really celebrating and engendering women power within GATS.
You know, when you talk of women empowerment or gender equality, I think the world has come a long, long way. There are changes sweeping across the world. You know, if you look at the Sustainable Development Goals, or before that, the Millennium Development Goals, there is a clear global compact that women empowerment is a key component of socioeconomic development today. Close to health, close to drinking water and sanitation, and other such socioeconomic attributes. The convening strength of women empowerment or women issues, the economic strength of women empowerment and such issues, the social imperatives of such issues, and how it is important today to bring all of this in a progress and development has actually got a huge global embrace. So we are very happy that women empowerment is being promoted across the world, and India, of course, is no exception. I would like to give some of the examples that I saw in the last 2-3 years, and it was a surprise for me, the kind of things that are happening in India, things that you would not see in books or you would not see people commenting as yet, because those changes are yet to be fully captured.
India is supposed to have a Mahila code, which means a fast track code for women in every state. But sadly, in Tamil Nadu, instead of having about 33, we have 5, which is an alarming rate, which is why the cases are pending, which is why women don't get justice. And a particular case has to be dragged on for almost 7 to 8 years, or even 10 years sometime, in order to get justice. And the poor woman has to keep going through the same torture and torment over and over again, coming to this courts, reliving it without being able to move on. Which is why I formulated a petition to the law minister stating that please open up the Mahila courts in every single district, and also please grant us justice within 6 months of the case, because a lawyer said that we don't need more than 2 to 3 months in order to get your evidence right in order to fight the case, which means we're just being lazy, not implementing the laws as has been written. So which is why I did the petition. Over about 5 lakh people signed it. I went to the law minister in Delhi. I spoke to them, and then in front of me, he actually issued out letters to all the chief ministers of every single state saying a Mahila court has to be opened up in every district of the country. So that is something which I'm proud that I was managed to, try and help out in.
It's time for the show break on Vision of Asia, Voice of the Community. We'll be back shortly. And welcome back. I am Aditi Lama, and this is Vision of Asia South Asian news segment. Let's now take a look at politics and its impact. Today, the House of Representatives voted to approve President Joe Biden's $1.9 trillion COVID-19 relief package, and it now awaits President's signature on Friday to make it into a law. President Joe Biden addressed the nation, thanking House Speaker Pelosi and other lawmakers for passing the bill, and said that this is a historic victory for every American. He also said that everything in the American Rescue Plan addresses a real need, including investments to fund our entire vaccination effort. The bill consists of stimulus checks of $1,400 and extends pandemic unemployment benefits as well. On this and much more, we spoke with ITV Gold senior political commentator Mr. Rohit Vyas, who discussed this historic package. Here is Rohit Vyas. What do you think are the most important aspects of this bill? What has been the key important factors that have stood out to you the most?
Well, several actually, but to highlight the most important is, of course, it's going to be giving a lot of aid for COVID relief itself, meaning the vaccination process and that type of thing. The budget, the new Relief Act will also bring in a lot of assistance to states. States' budgets have been devastated, whether they're Republican or Democrat, doesn't matter, but it's going to give a lot of budget boosts to the states so that they're able to make up for lost tax revenue over the past year because of the pandemic. Number 3, of course, is going to be helping a lot of individuals in America. This is the biggest relief package possibly ever passed in U.S. history. And it's going to be extremely significant because what they're trying to do is go all out with interest rates being as low as they are, probably at zero, go all out, infuse the markets, infuse people with capital so they can all bounce back, and then look forward to a robust economy. So they've extended the unemployment benefits. They're going to send out some more IRS checks for tax relief, the $1,400 checks to those who qualify, to households that fall within the budget for that, and so on and so forth. I expect to see an immediate boost to the economy, either through people saving what they have to, paying off bills, or just going out and beginning to patronize businesses as they all reopen because of the rollout of the vaccines. The most important will be the rollout of vaccines with the help of money from this budget. And more significantly than the unemployment and all the rest of it is the fact that states, many of whose infrastructure has been threatened by the dire consequences of a lack of tax collections, will be able to recover themselves. And once that happens, they can implement programs to give businesses boosts, to give individuals boosts, and to therefore overall increase employment. The goal, of course, of all this is to get rid of these unemployment numbers, to get rid of all the business failures, and to once again give a shot in the arm to the economy.
Right. Let's talk a little bit more about these stimulus checks and also the extended unemployment benefits. They brought it down to $300 from $400 in negotiations. And also the $1,400 stimulus check, in the third round of these stimulus checks, it's not going to go to every individual that got money in the first two rounds of the stimulus checks. They have reduced the qualifications for who should receive it or not. How have you analyzed it? Was it a smart decision on them to do that?
I think it was actually Joe Manchin in the Senate. Joe Manchin, the moderate Democrat, or the conservative Democrat, if you will, was the one who raised the objections, and he was the one that wanted the extra $400 trimmed down to back to $300. When you think about it, it's not a bad decision. You don't want to just throw money away, just dole it out free, because it's not free. Eventually, they're going to be the next generation or two of Americans who'll be paying for this deficit. Of course, President Biden's assertion has been that this is the time to pump in money into the economy, to do things like this, because we'll be able to afford to repay the debt as long as interest rates are low. I think Joe Manchin's intention was to make sure that we didn't go ahead of ourselves. In other words, saddle our own children and grandchildren with enormous debt that they would all have to be paying through income taxes and the like. So I think that aspect was very, very good. As to the stimulus, yes, of course, there were a lot of people who turned out who were making above $150,000 jointly, like up to $200,000, $250,000, or $300,000 receiving the full relief check. They really didn't need it, because people like that are assumed, people who are in that income bracket are assumed to have had some cushion of savings and able to withstand some of the pandemic's onslaught. And so it's pretty reasonable. And I think we're now talking in the context of people getting vaccinated. We're hearing about the downward trend in COVID spread. We're talking about less hospitalizations, less deaths, etc., which means people can now get back to a normal activity at some point, which means we can see some normal employment beginning to take shape, and maybe robust employment. So therefore, I think the idea was not to go completely all out and just throw the money away, because now things have already begun to improve, and to just make sure that this money goes to those who really need it up to September. And then they're going to review and see forward if anything more will be necessary.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Diti Lamba. Take care and be well.